Being recorded.
Good afternoon, everyone, and welcome to the Respectability webinar for June 15th, 2016. My name is Phillip Paul. I'm the Policy and Practices Director for Respectability, and I'm absolutely delighted to share with you today information being presented by Irene Bowen and made possible by the Chicago Community Trust. And today we're going to be talking about a very important resource called Renewing the Commitment, an ADA guide from the Chicago Community Trust. This webinar and the other webinars of our summer learning series are made possible by the generous support of J.P. Morgan Chase. They allow us to provide you with these learning opportunities, to offer you these webinars for free, and you will be able to download the materials after the presentation, and we will also be posting a archived copy of this webinar with captions on our social media streams. Now, first, I want to begin by extending a special thanks to the Chicago Community Trust. They're the ones who made this possible. They facilitated the connections, and there are some wonderful people. And the Chicago Community Trust is a community foundation dedicated to improving our region through strategic grant making, civic engagement, and inspiring philanthropy. They endeavor to serve the non-profit organizations, generous donors, and thoughtful residents who strive to make a difference, helping their bold vision create lasting community change. One of the manifestations of this work is the Renewing Commitment Guide that Irene will be talking about today. Now, Irene Bowen is the president of ADA One LLC and a nationally recognized ADA consultant, trainer, and speaker. Before starting her firm in 2009, she was the Deputy General Counsel of the U.S. Access Board and then Deputy Chief of the Disability Rights Section at the Department of Justice, where she oversaw the enforcement of the ADA and was actively involved in the development of the ADA accessibility guidelines, as well as DOJ's Title II and Title III regulations. Irene's clients include state and local governments, colleges and universities, healthcare providers, other public accommodations, and a federal agency. She teams with architectural firms and others in assisting entities with self-evaluations and transition plans and the development of cost-effective approaches to ADA compliance. Since 2011, Ms. Bowen has authored or co-authored 5 ADA guides presented internationally and assisted in self-evaluations of Fulton County, Georgia, the City of Chicago, and several universities and healthcare providers. We are absolutely delighted to turn the floor over to Irene. Take it away.
Thank you, Philip. I appreciate it. It's wonderful to see so many of you here today to learn about the guide. I want to also thank the Chicago Community Trust for publishing the guide, and I want to thank Respectability for bringing together this broad-based group of people from all over the country. We are going to focus, this is basically a guide to the guide that the Chicago Community Trust has published. It came out earlier this year. It had been produced as a result of a coalition of groups in Chicago marking the 25th anniversary of the ADA, which was last year. So ADA 25 Chicago was that coalition, and they, in conjunction with the Trust and other groups, had months of activities related to commemorating the anniversary, celebrating it, and actually coming up with numerous products that can be used by consumers, advocates, those who provide services. And that's how the guide came to be. The Trust wanted to update a 2010 guide that it had published and that our firm had drafted. So we worked together to come up with this updated version that addresses some of the changes that were made by the 2010 regulations from the Department of Justice. It's intended to assist nonprofits, but it also is helpful, I think, to a number of others of you who are participating today. It can be helpful to advocates, those in higher education, state and local governments, and private groups that are not nonprofits as well. And I'll point out which parts of the guide may differ a bit, which provisions may differ a bit for those of you who are in those groups as opposed to nonprofits themselves. The guide starts with an introduction that gives an overview of the population of people with disabilities and the ADA, and it points out that almost 20% of individuals nationwide are people with disabilities. I think it's probably more accurate to say that that percentage is what those who self-identify as having disabilities. Probably the number is even larger when you take into account those who don't consider themselves to have a disability, and the very expansive definition that's been in place since 2009, the expansive definition of who is an individual with a disability. But generally, at least half of us are affected by disability-related issues. President Obama said on the 20th anniversary of the ADA that half of us are personally affected, meaning that we have or will have, by the end of our lives, a disability, or that we love or will we love someone who has or will have a disability. He was referring to families in large part, so assuming that we all love everyone in our families, I think it is accurate to say that at least half of us are personally affected or will be affected by disability-related issues at some point in our lives, even if we aren't now. Statistically speaking, and this is important to nonprofits in particular, people with disabilities are twice as likely to live below the poverty level. They are much more likely to be undereducated or to be and they're less likely to be in the workforce. And even if they're in the workforce, there's a significant earning gap as compared to people who don't have disabilities. So considering that many nonprofits are working to decrease the number of those who are in poverty or to serve them, to improve educational opportunities, and to prepare people for employment, this guide can be particularly helpful with respect to those missions. The numbers are about 57 million people with disabilities, and I think traditionally you may think of people who use a wheelchair, people who have hearing disabilities or vision disabilities, and that is part of the group. But there are a number of other disabilities, and it's not always apparent. In fact, it's usually not apparent that someone has a disability. But the frequency is listed here. The most frequent disabilities are listed here. It includes those that I mentioned. It also mentions those who have mental illness, those who have learning disabilities, AIDS, cancer, diabetes. There is a broad range of conditions that can be disabilities. And there's some additional data here about people with mental illness. And approximately 18% of the population, the adult population every year, has been reported to experience some type of mental illness like depression or bipolar disorder, which would make them people with disabilities. So what we've tried to do is join nonprofits as to the activities that they usually conduct and with the intersection of disability. So here I've just listed the types of things that nonprofits might typically do, and all these are addressed in the guide. These are also things that others of you provide as well, and that state and local governments may help to support or to fund. So again, it is something that I think will apply to most of you. The guide covers those things that the ADA covers with respect to nonprofits. So that includes communication, whether it's with the public or on a face-to-face situation, small groups, etc., meetings, classes, events, other types of person-to-person contact, websites, facilities. The ADA also covers employment, but this guide does not address that. That's a different area that has some different types of principles that we just chose not to go into in this guide. As to those types of areas, the ADA addresses the policies and operations of an entity, physical access to facilities, effective communication, and integration, which basically means ensuring that people with disabilities are not segregated and that they are made part of the community. The guide is divided into a number of sections, and there is not only the guide, which is about 125 pages, but there's also a separate summary of the guide. It's about 8 or 9 pages, I think. Both are available online. There is both a PDF and and a Word version that's accessible with photo descriptions, etc. Right now, I think the Word version is not online, but it was taken down for some changes, but it will be back up very soon. So I've given the links at the end of the webinar, so feel free to explore that, print it if you need it, read it online, and while you're there, check out all the other activities that the Trust has, some related to people with disabilities and some not specifically related. So when you look at the guide, you'll see, as I said, there's a guide and then there's a separate summary. And here I've listed what the sections are of the guide. And I'm going to go into each of these in a bit of detail, but you'll see that there's one that says building blocks, and that's basically several of the provisions of the ADA just reduced to the most important concepts. And then taking stock or getting started is where I would suggest that you start if you haven't given serious thought to whether you're complying with the ADA and doing all that you can to include people with disabilities in your operations and services. And I'll explain why I think that's a great place to start when we get to that section in order. The guide also looks at, makes suggestions as to personal interactions, which is sort of a customer service concept. How do you relate to individuals with disabilities? Then we have details on some typical common issues, such as facilities, communication, and policies. We go through, then we go through some specific services and activities that nonprofits provide, like housing, health care, transportation, recreation, etc. And then we end with an agenda for action, some steps that are set out in a very organized way, I think, for going forward. And we have some helpful additions. It's not just text. We have a number of photos to illustrate our points. We also have some icons that indicate, for example, resources with links. We have thumbs up for easy steps that you might be able to take right away. Those might include changes to personal interactions, something as simple as replacing round doorknobs with lever hardware. We have thumbs down for things that are not a good idea. We also, and a number of other icons, and we have some that relate to things that are specific to the Chicago area. Again, we address a number of diverse types of disabilities. We've talked about the traditional ones, and here, those that people traditionally think of. And here you have just some photos of people with vision disabilities and hearing disabilities, mobility disabilities. The child on the right here may have an intellectual disability, but as I mentioned, you often can't tell. You can't tell if someone has epilepsy, allergies, asthma, a heart condition, etc. So it's important to provide for the needs of all types of people with disabilities in advance so that you can ensure full inclusion. All of what we've done in the guide is based on the concept that the ADA is a civil rights statute. People sometimes forget this. They think of it as a building code or something similar to that, but it is based on prior civil rights laws. But unlike some civil rights acts, the ADA does not mean that you treat people with disabilities in the same way as you treat others. And this is an important distinction which plays out throughout the guide. Sometimes it does require that people be treated differently in order to have an equal opportunity. So in other words, you may have, today, you can see on the screen, we have captions. If we invited everyone to this webinar, but we didn't have the captions, people who need those because of hearing disabilities in particular would not be able to benefit from this presentation. So in a way, we are treating people differently, and the ADA does require that in many instances. So the first section starts with an overview. It explains that the ADA applies to places of public accommodation, which is what most of you are, and nonprofits would fall under this category. Then we go on to explain how disability and the social environment interact, that it is actually the environment that places barriers in the way of people with disabilities. We talk about some of the other laws that might apply in addition to the ADA, and we summarize and go into a bit of detail on the various types of disabilities, people with disabilities who are protected by the ADA. The next section, Section 2, is called Building Blocks. We talk again about how the hallmark of the Act is equal opportunity, civil rights. One of the principles that underlies the ADA is the need to make reasonable modifications to policies and practices. There's also a requirement that new and altered facilities meet specific accessibility standards, and that under certain conditions, barriers to access have to be removed. Effective communication must be provided, and services are to be provided in the most integrated setting. We then explain a bit about what each of these means. We go into equal opportunity, reasonable modifications. Basically, reasonable modifications mean that if it's necessary in order to avoid discrimination, you have to make changes to the way you've always done things, whether these are written practices and policies or just your way of doing business. So, for example, if you have a no animals policy or a no pets policy, there are instances in which that has to be modified to allow someone with a service animal or a service animal to accompany that individual. If someone can't get to an event or a meeting that you're having because it's not accessible, you may very well need, and you usually will need, to move the place of that meeting. If someone can't make it to a session that they're required to go to in order to continue to receive certain benefits because of the timing, and that relates to disability, then that timing may need to be changed as well. And we give some specific examples of that in the later sections. Effective communication is another area that we summarize here and go into later. And we explain that auxiliary aids and services are to be provided for people with disabilities relating to communication. That can, for example, include interpreters, as you see in this photo, for people who are deaf or hard of hearing, assistive listening devices that amplify sound, large print documents for people with vision disabilities, accessible electronic formats for people with disabilities related to vision or related to learning disabilities, Braille, captioning, as we're doing now, etc. As to physical access, we explain the requirements generally for new construction alterations, for existing facilities, and then something that is often overlooked, maintaining accessibility, which means once you have a feature that's accessible, you have to make sure it stays accessible. That's something that is specifically in the ADA regulations. You have to keep an accessible route, for example, from parking to the entrance. You have to keep that clear. You have to make sure that motorcycles don't park in the access aisle for accessible parking spaces. You have to be sure that you don't block the reach to elevator buttons with wastebaskets, planters, etc. In Section 3, I mentioned that I think you should start here if you have done very little so far. And even if you have gotten a pretty good start on ADA compliance and inclusion, I would suggest that you might consider starting here. The Quick Check tool has 70 questions that you answer yes or no, and it helps you identify what you've done already and where you might need to include, where you might need to improve. So the topics are listed here. We go through planning and policies, facilities, communication, the topics that I've just mentioned. And here is an example, a screenshot of part of that Quick Check tool. So you'll see that there are 4 questions here. 2 of them are highlighted in green. And if they're highlighted in green, those are the ones that we suggest that you look at most carefully and that you consider taking action with respect to these if you haven't done these steps already, because these are things that can be done relatively easily and without a great deal of expense. So, for example, you see under number 1, which is not green, and partly that's because it may take a little bit more work to comply with this. We say, do you hold meetings and events only in accessible facilities, or you give notice that you're having a meeting, and if you need to move it to an accessible location, you give notice that you will do that. So there's a yes and a no, and then in the last column we have sections in the guide that address that issue, and those that are highlighted and underlined are links, so you can click on that number of the section and go to get more information in the guide. There are about 70 questions. In addition to the ones that are here, there are questions, for example, about, one of them is, have you communicated your commitment to compliance to your staff? Are you aware of how to interact with people with disabilities? Is your staff aware? Do you know how to assist a person in an emergency if they need assistance? Do you keep the accessible routes clear of obstructions, et cetera? So those are just a few sort of spot checks. They don't include everything that you need to think about for compliance, but looking at those and seeing where you are will get you off to a pretty good start. The next section is about serving with sensitivity and courtesy, and we just have some general tips about the types of language to use, terms to avoid, the importance of referring to a person first. The man who has a learning disability, the person who does this has this disability, as opposed to saying the disability first. We go into some very basic types of disability etiquette. Speak directly to someone, not to their interpreter or their companion. Maintain personal space, as we show in this illustration. The person is there's an individual who uses a wheelchair, and then someone who happens to be the Chicago Community Trust is speaking to her. He's kneeling down. He's maintaining space. He's not leaning on her chair. Don't assume that you know what a person wants or needs if they have a disability. Don't just start pushing their chair or opening a door. Don't just take a person who is blind and start leading them. It's important to ask before you do anything like that. And then from a customer service standpoint, there are some tips about how to work with people with various disabilities, including those with speech, cognitive, and psychiatric disabilities. Then we go on to sections 5 through 8, which drill down a bit into these concepts with respect to different areas that generally will apply to most nonprofits, and that's before we go into specific types of services that nonprofits may offer. So we cover facilities, communication, policies, meetings, etc. Each section has a certain format. It starts with a page maximum of highlights, what's to come in this section, then the main content, and then there's a page, sometimes 2 pages, of next steps, very specific steps that you can take with respect to that particular category. As I mentioned, there are a number of updates from the 2010 guide. Generally, these, I've listed what some of those are here. The regulations that came out in 2010 were much more specific, in 2010, were much more specific than the 1991 regs as to service animals, what they are, what kinds of questions you can ask. There are specific standards now as to recreation areas like boat ramps, miniature golf courses, play areas, etc. And the regulations have much more detail as well about health care and certain areas of communication. And we have also updated although there's not much in the regulation yet, we've included best practices as far as web accessibility and electronic information technology, which would include things like kiosks, point-of-sale devices, etc. So as to Section 5, which is facilities, we summarize some of the areas that are covered in the new construction standards and some of the more difficult issues with respect to alterations. And then we have a discussion of barrier removal. Those of you who are nonprofits, businesses, or other entities that aren't state and local governments are subject to the requirement that you remove barriers in existing facilities if doing so is, quote, readily achievable. And that means easily accomplished without much difficulty or expense. What's expected is based mostly on the size and entity of the resources of the entity, the size and resources, and how difficult the change would be. So we've given some examples of those things that will often be readily achievable and therefore required by barrier removal. That would be, as I mentioned, putting lever hardware in doors, grab bars in stalls and toilet rooms, rearranging furniture, etc. Those of you who are with state and local governments aren't subject to this requirement, but you do have to ensure that your programs are accessible to people with disabilities, and to the extent that that means you have to provide access, physical access to particular facilities, you would have to do so. It's a different and somewhat more stringent requirement, and again, because this guide addresses Title III entities, we have not gone into that. But the requirements that we go through for new construction and alterations are generally going to be the same for nonprofits and other private entities, as well as Title II entities. So we also talk about furniture and equipment, what the standards are, and then what you do if there aren't standards for certain types of furniture and equipment. We cover, we summarize elements of the standards that relate to such things as parking, entrances, counters, elevators, restrooms, etc. We talk about to what extent you're responsible for services in buildings that aren't yours, that you don't own, but that you lease from others, etc. We also have drawings and photographs throughout the guide. This is an example of one that's in the section on facilities, and it's taken from a DOJ publication. It's intended to illustrate types of changes that can come under the category of barrier removal. So you have repositioning the paper towel dispenser if it's too high for someone to reach. Putting in a full-length bathroom mirror if people who are of short stature or people who use wheelchairs can't see the mirror over the lavatory because it's too high, for example. And in this section, I mentioned that we give examples of next steps at the end of each section. So some of the ones in this section are to make sure you plan for accessibility and that you budget for it. If you find that you have a problem that you need to address by making some changes to the facility, that might take some money, and if you haven't budgeted it, planned for it, you may not be able to do it quickly enough. Assess the facilities you use, develop plans for removing barriers, and work with landlords towards that same goal. Understand the standards. We remind people not to forget about the path of travel requirement. That means basically that if you are altering a facility and then you need to spend up to 20% of the cost allocated for the changes for accessibility improvements to areas such as the bathrooms serving that space, the accessible route from parking to the entrance and from the entrance to that space, etc. And that's sort of it's a bit complicated, but we try to make very clear what that requirement is because it's often overlooked. And then again, we talk about making sure that those items that are accessible are kept that way. That means elevators, lifts, I know you've probably seen those break down, accessible routes, etc. Then we go on to communication. And again, we start with the highlights, which include you must ensure effective communication. That means often that you have to provide auxiliary aids and services, and that you don't have to take those steps if it will be an undue burden or a fundamental alteration to your program. In that section, we explain that the decision about whether something is effective is case by case. It depends on the setting. Are you communicating with someone one-on-one in a small group? Is it a large gathering, etc.? What does the individual prefer? If someone has traditionally used and prefers to use a sign language interpreter because of their hearing disability, then that's something that you are generally going to defer to. You're not going to offer, for example, a transcript, or why don't you just read lips? If someone prefers to use an accessible electronic format rather than Braille because of their vision disability, then you generally are going to defer to that. And you also can consider the cost of alternatives, but you have to ensure that whatever decision is made as to what is as to the auxiliary aid or service that's provided, you're providing effective communication for that individual in that situation. And we give a number of examples of that. Here are some of the examples of auxiliary aids and services that may need to be provided, depending on, as I mentioned, the circumstances and the preference of the individuals. We also go into the different types of sign language that are used in our country. Video remote interpreting, which is illustrated here. Here you have an interpreter on the monitor who is at a remote site. So you have several people around the conference table. The woman on the left is signing, and the interpreter is then voicing what that person is saying back to the crowd, the group, and also signing to the woman who is on the left. The interpreter is signing to her what the individuals in the room are saying. It's just like having, in many instances, it is as effective as having an interpreter on site. In others, it's not as effective. And we go through what the factors are to consider when you're deciding whether to do live or remote interpreting. And again, the key is it effective for that individual in that situation? We also talk about TTYs and telecommunication relay service calls. These are calls, the telecommunication relay service is provided by each state under the ADA requirements, and it provides a means for those who don't use what we think of as traditional telephone services because of speech or hearing disabilities to communicate with those who do use those services. So there's a communication facilitator provided by the state who basically translates text sent by the person with disability, translates that into speech for the person on the other end of the telephone line, and vice versa. We explain how it's important to make sure that people know how that works, that they take those calls, that they don't hang up, and that they stick with the call until its completion, even if it takes longer than others do. Here at the end of this section where we give the next steps, some of the ones that we suggest are identify how you communicate and what types of aids and services you're likely to need to provide. Figure out what you can do in-house and what you need to contract for. Learn about the things we've mentioned, telecommunication relay services, video remote interpreting. Learn about the technology and make sure that your staff is familiar with them and knows how to use them. Have a standard notice of what accommodations you make available, and we give some suggested language for those in the additional templates and notices at the end. We have some samples for you. Track how you use your auxiliary aids and then see how many people ask for interpreters or ask for assistive listening devices, ask for accessible electronic formats. And 6 months later, see how you've done and whether you're able to meet those needs. Then we go on to the next section about general policy considerations. Some of this is going to apply to everyone, I think. There are some where we go into more detail because they're a little more complicated, a little harder to understand. That would include, for example, eligibility requirements. The ADA says you can't screen out people with disabilities with specific eligibility requirements unless they're necessary. You can't, for example, say that someone has to be able to attend an exercise class on their own if they might need an assistant, an adult, with them to help them get through the class. Again, it's a case-by-case basis. Safety can be considered, but there are limitations to what kinds of decisions you can make based on just a perceived risk. It has to be a verifiable risk. You have to do what you can to minimize that risk when you're considering what your eligibility requirements are, whether it's eligibility to participate or to continue to participate. It's important to think about your volunteers. Those who want to be volunteers are not only helping you, but they're also getting a benefit from volunteering. So you want to be sure that they have an opportunity to do that they have a range of things to choose from. You may need to make some adjustments to the types of opportunities you offer so that volunteers can participate and get that the benefits that all of us get from volunteering, whether or not they have disabilities. For example, you get a sense of community. You feel that you're contributing to your community. You increase your skills. You get interaction with others. So that's something that I think we often overlook, but we really do need to focus on. Are we making our volunteer opportunities accessible? Do you have separate programs, and are those necessary? It may be okay, for example, to have a wheelchair basketball league in your recreation program so that people with wheelchairs can participate in basketball, because it is probably a safety risk to have people who use chairs and those who don't on the court in those circumstances. But apart from that, many times you will not need to have separate programs for people with disabilities and those without. You also should be looking at your emergency evacuation plans to see if you're addressing the needs of those with hearing impairments who might not hear the announcement, the audio announcement that there's an emergency in the building. Those with mobility disabilities who might need assistance when there's an evacuation of a building, or might not want assistance. It's important to consider the needs of individuals and to consider, is there a place where people with mobility disabilities can wait in safety for someone to come and assist them. There are a number of difficult issues there, and we sort of lay out what those issues are. I mentioned service animals. We go through what the regulation says, and we emphasize that there are only 2 questions you can ask, and your staff should all know what those questions are. It's basically, is this an assistance animal required because of a disability, and what does it do? You can't ask questions specifically about the nature and severity of a person's disability. Then at the end of that section, where we talk about examples of next steps, we suggest that you look at your eligibility requirements. You may not even realize what some of them are. Some of them may be written down. Others may just be assumed. So you want to evaluate those. You want to look at ways in which you offer tests or conduct interviews, whether you have separate programs that should not be separate, whether you have adequate service animal policies, and how you would work with individuals in the event of an emergency evacuation. Then in Section 8, we start here to address, here we address various types of meetings, classes, any kind of gathering of individuals, and we look at the provisions related to all of the substance that I've mentioned already, physical access, communication, policies, etc. And we again suggest next steps. Identify what types of events you have. Do you have one-on-one meetings? Do you have small group meetings? Do you have interviews? Do you have large events? And how do you address accessibility, meaning not just physical accessibility, but other types for each of those events? What spaces do you use regularly? Are they accessible? Do you have a plan for what you do if anybody can show up at a meeting? If you use space that's not accessible, that won't work, because then you aren't going to be able to move it, because no one even has an opportunity to ask you to do so. Then we get into a few sections that are specific to types of services, and we have specific suggestions for each type, good examples of good practices. We highlight some settlement agreements from Department of Justice, Health and Human Services, and others that you might want to look at to guide you as you look at these different types of services. So, for example, the performing arts, which includes plays, concerts, shows, athletic events, etc. And we go into best practices relating to facilities. Ticket counters. Do you have lowered ticket counters for people who need them? And are those the ones that are always open? What about accessible seating, effective communication? You see a young man using an assistive listening device here in a theater. And are people trained, your staff, ushers, etc., to know what the policies are, to know where the accessible seating is, to use adequate etiquette when they're assisting people with disabilities? We have a section on museums and exhibits that, again, talks about physical access to the exhibit, as you're going through the exhibit, as you're leaving. We tell you a bit about the specific provisions about historic buildings, make suggestions about how to communicate effectively through exhibits, especially with interactive and multimedia, which we're getting more and more of, and which presents can be challenging. We have some suggestions. We have some settlement agreements that you can look at there. And we go on to healthcare. We address types of healthcare that might be provided by small clinics, by small nonprofits, as well as larger ones such as hospitals. And here, the physical accessibility has the same requirements as other facilities, but there are some more specific ones as to patient rooms, communication, telephones, etc. And we also focus on video remote interpreting, because there have been a number of instances where people with hearing disabilities have said that use of VRI in a hospital or a healthcare setting is not effective. And we talk about how to go about assessing whether your use of that might be effective. Again, we have some settlement agreements specific to healthcare, and we talk about the guidelines that have been proposed by the government for accessible medical equipment. These aren't yet final, but they can be used as good practices. We have some discussion about shelters for people who've experienced domestic violence or those who don't have homes, etc. This is an important area for nonprofits who are providing these types of services. One reason is that people with disabilities are disproportionately represented in this population. If you only have some shelters that are accessible, there may be issues for individuals finding those shelters, knowing which ones are accessible, or getting to them. But it's not just the physical accessibility. It's also important to look at the benefits that people get and to make sure that people with disabilities have the same opportunities as others, which may mean making some policy modifications. And we have some very specific suggestions there. Childcare is another area in which nonprofits are pretty active, and some of the government entities may also be funding this. We go through the need to make an individual assessment of whether you can accommodate a particular child. And, of course, this is also going to involve auxiliary aids and services. You may need to provide alternate food choices for those who have serious allergies to certain foods. Staff will need to be trained. You'll need to look at your policies for providing assistance to those who have asthma or diabetes and monitoring their conditions. Then we do have a section on recreation and athletics, which, as I mentioned, is addressed in the accessibility standards that came out in 2010. And we also discuss some of the policy considerations there. We have a section on transportation, which often may be provided, for example, by senior citizen centers. If someone's going on a day trip, you may provide transportation for field trips, et cetera, and it's important to know what your obligations are in that respect. We have a section that is expanded from the 2010 version about websites and other technology. As I mentioned, there are generally not specific ADA requirements in the regulations yet, but it's not too hard to figure out what the Department of Justice, who issues the regulations, thinks public and private entities should be doing, and they've issued quite a bit of, they've issued some guidance, and they've also entered a number of settlement agreements. There are also some private settlement agreements that can be very helpful. So we've gone through those and gleaned what we can to help you and included some very specific suggestions as well as some general principles for websites and other technology. And then in Section 10, we have an agenda for action, and we suggest that you go through these steps as you're moving forward. It's really important to make a commitment that comes from the top, to have the president or the chairperson of the board or your chief executive officer let people know that you intend to comply with the ADA, that you intend to foster more inclusion, that you intend to follow best practices. Name an ADA coordinator. You are not necessarily required to do that as a Title III, a public accommodation, a nonprofit, but it certainly is a best practice to have one person who's the contact for everything that you do related to the Americans with Disabilities Act. And set aside resources. That's another way of making a commitment. Be sure that whatever you do, you collaborate, you communicate with people with disabilities. And we suggest you do a client path analysis, which means putting yourself in the position of someone who's coming to visit you, starting with what's on the website. Are you welcoming? Do they know how to find you? Do they know what's accessible? Once they get to your building, if they come there for services, what path do they take physically? And is that path accessible? And then how do your policies interact with that individual? You know, step by step through the sort of the chronological process. Are you meeting the needs of people with disabilities in a way that does not discriminate? We suggest that you put this in a plan, that you have all aspects included: bear removal, policy, communication, website accessibility, and then let people know you're doing this. You know, don't hide your light, as we say. Let people know what you're doing, monitor how well it's going, reflect on it, and then see if you need to adjust it. Above all, and you may think this goes without saying, but treat people with disabilities with respect. We suggest that you, as I mentioned, have someone responsible for ADA compliance, and that you have someone, it may be the same person, responsible for putting your plan into action and keeping it going. Have specific steps and time frames and hold people accountable to meeting those. Look at your contracts. Figure out if you need to put some compliance provisions in there. And assess what types of training you might need for your staff or your partners. And how are you going to monitor compliance? How will you stay aware of the changes in the law? And how will you respond to complaints that come in? I mentioned that we have some extras in the guide. At the end is a glossary of communication terms, such as auxiliary aids, assistive listening devices, video phones, video remote interpreting, etc. We have an extensive list with links to national resources, those specific to Chicago, some specific topics, and even nationwide ways that you can access services and products on a local level and then nationwide. We also have a number of templates. We give you some sample meeting notices. There's a template you can use, how blank organization provides communication assistance, how the organization makes accommodations and modifications, and then what features the building has. It's a fill-in-the-blank type of template. And then there are, I think, 10 tip sheets. Each is 1 or 2 pages with illustrations and bullets basically, about a number of the topics: interacting, interpreters, planning for accessible meetings, special events, etc. This slide has the link to the guide at the Chicago Community Trust website. There's a link to the PDF format and the Word format of both the guide and the summary. And as I mentioned, the Word format, if it's not back up, will be soon. And once you get to that cct.org website, you can explore all the other ways in which the Chicago Community Trust is serving people with disabilities as well as others, and how they're partnering and working with so many different nonprofit groups. And I think that leaves about 10 minutes for questions if we have them.
Wow, that is a very impressive presentation, Irene. Operator, do we have any questions from the phone? And would you explain how people can ask questions?
Participants who are dialed in for audio can press 7#, that's 7 followed by the pound sign on your telephone keypad to indicate they'd like their phone open so they can ask a question. All participants can submit questions on the web by typing their message below the chat box and pressing enter to send it. Again, that's 7# on the telephone keypad. No questions in queue on the phone at this time.
All right. Well, I have a question that I thought, something that you brought up, Irene, that I hadn't actually thought about, but I think is a really interesting idea, especially for folks on the workforce development or VR side, is could you talk about the customer pathway analysis? How would you do that? What would that look like? And then ultimately, how would you measure any adoption of policies or changes in an organization or an agency?
Sure. This is just a concept that we've used before, and as you said, it can be very helpful. It's not in regulations. It's not a term of art, but generally it means think about a client, and let's say if you can identify maybe 6 types of services you provide, then you would go through this analysis with each service, and you would think, how do people interact with us? How do they interface? First, how do they find out information about us? That would lead you to think about whether, if people go to your website, is it accessible? If people are looking for childcare and you have a map of 7 locations where you offer it, can they even access that map if they have vision disabilities or learning disabilities? If you use brochures to publicize your services, are they accessible? Are they in large print? If it's word of mouth, there's not a lot you can do about that, but if you go into the community and you make presentations to potential clients, are those accessible? Just generally, how do people find out about your services? Then you think about, what are the eligibility requirements? What does an individual go through in order to access the services? And you would evaluate that as to communication, policies, filling out forms. If someone has to fill out forms to get services, does your staff know that they should help people do that? If they have trouble, if they have manual dexterity issues and can't have difficulty writing, or if they don't understand the complicated instructions, et cetera, do you have those in a format that's accessible? And then you think about the physical accessibility. If they come to your office or where you provide services, what are the physical barriers that they might encounter? So you think about the path that someone takes to each of your services at each point, and just assess that using the quick guide, the quick start guide perhaps, or delving more deeply into the particular requirements. And that can work with all sizes of entities. I think it can, if it's a small nonprofit that might have 3 staff and and goes into neighborhood centers to provide services. It can work there. And it's a good way to get started and to just assess what you might need to do generally.
Great. Operator, do we have any phone questions?
Yes, we do. One moment. Debbie, please ask your question.
Hi. About compliance, who monitors and enforces, and what do you do if there is non-compliance?
Good question. The Americans with Disabilities Act puts the compliance responsibility mostly on the Department of Justice. And I used to work at Justice. We would accept complaints. We would also do compliance reviews if we thought there was a reason to look at a particular entity. And the Justice Department, there's no ADA police exactly. Obviously, there's a limited number of resources within the government, so it does tend to be complaint-based. The compliance tends to be complaint-based. But it's also important to remember that individuals can bring their own lawsuits if they have a problem that they don't want to take to justice or that justice doesn't respond to. And in fact, that's where most of the highest number of complaints are brought by individuals through private lawsuits. There's no one who requires that you submit a plan. There's no one who reviews the plan. Enforcement usually results from a complaint that's sent to the federal government or that the private attorney takes on.
Great. Thank you, Debbie, and thank you, Irene. Operator, any more phone questions?
No further phone questions at this time.
Okay. Well, I've got another question for you, Irene. Obviously, the ADA was passed 25 years ago, and back then nobody had heard of the internet, and now social media and websites are kind of the bread and butter of how a nonprofit or an agency gets their message out there and how they advertise. And so I'm wondering if we could go back and talk about the accessibility piece. I'm wondering if you could point some folks in the direction of resources for checking if their website is screen reader accessible, getting captions on any videos they post, information resources around just how do they ensure the maximum accessibility of a nonprofit website or social media stream.
Great question. There are a number of resources online. There are some at the Access Board's website, which is www.access, board, BOARD.gov. And there are the industry standards, which are generally the basis for proposed regulations, and those that do exist now are through the Web Accessibility Initiative, and they're called the Web Content Accessibility Guidelines, WCAG or WCAG. And I highly recommend that website, which is www.w3.org. We have a list of resources in the guidebook that you can also go to. And what you'll find is that the industry guidelines are the ones that some state and local governments have adopted. A lot of those in higher ed have adopted. I know we have some people from higher ed in the audience. The WCAG guidelines are the ones that are generally referenced in settlement agreements with private or nonprofit entities. And they cover things like how you make your website compatible with screen readers, which is the technology that would be used by a lot of people with vision disabilities, learning disabilities, et cetera, where the text is translated to speech. And you have to have, there are certain requirements that make that work. And if you don't address those, then people are left unable to access your site. So you need to pay attention to things like how you navigate through, font size, the style, contrast, using color for meaning, captioning videos, documents that you post should be in a format that is accessible, etc. So all those things are addressed by the accessibility guidelines of the private group. Those two websites, I think, would be the best place to start.
Great. And I put some of those links in the chat box if anybody wants to go take a look at those resources. I also put in a link to a webinar that Respectability did last year about easy tips and tricks to ensure web accessibility. Operator, do we have any more phone questions?
No further questions.
All right, and I don't see any further questions in the chat box. So first, I want to express my deep thanks for Irene Bowen, president of ADA One, and her presentation today. I think she covered a lot of material and pointed people in the direction of a lot of really great resources that will really positively impact their work and ensure greater accessibility for people with disabilities. Check out the Chicago Community Trust's website where you can download a copy of the Renewing the Commitment Guide. Irene's website is ada-one.com. Additionally, I want to invite you to join Respectability for our next webinar on June 29th. And here we're going to be shifting focus again to talk about best practices in action. We're going to be talking about youth transitions in Iowa. We're going to have a presentation from the folks who run the VR system in Iowa around their innovative work supporting employment for youth with disabilities. And I invite all of you to attend. Last of all, our contact information is available, and thank you, Irene, thank you, Chicago Community Trust, and thank you, JP Morgan Chase, for making this possible. Operator, that's it.